I'm back with another piece of super interesting research that I wish everyone knew about. Today, I'm going to be talking about the Adverse Childhood Experiences Study. I imagine many of you have already heard of ACEs, but I'm venturing to guess I'll be sharing some information today that you've never heard. This is a big one, so I'm going to break it up into a 3-part series. Lots of trigger warnings with this one. I will be talking about child abuse. I will be talking about sexual abuse. I will be talking about domestic violence, suicide, premature death, etc. Proceed with caution. A lot of people are surprised when they find out that the association between childhood trauma and bad outcomes in life is relatively new. And this was discovered by a medical doctor, not a psychologist, who was working in an obesity clinic. This clinic was run by a man named Dr. Folletti. He was interested in studying weight loss techniques. He helped a woman lose 275 pounds in less than a year. And then a few months later, she gained back 37 pounds in 3 weeks. He asked her what happened. She said she was sexually harassed at work. She subsequently gained back all the weight. We asked her why she had had such an extreme reaction to the harassment. She said that she had been sexually abused as a child. So long story short, he polls everyone at the clinic and finds that more than half of them have experienced sexual abuse, among other forms of abuse. When he goes to the literature to examine the association between childhood trauma and weight gain, he can't find anything connecting childhood trauma to physical health. So he recruits Dr. Anda at the CDC to see if they can, on a large scale, measure whether or not people who are struggling with physical health problems also have a history of childhood adversity. They created what is known as the ACEs questionnaire, 10 questions covering a wide variety of different child adversities that someone may have encountered, everything from emotional abuse, physical abuse, divorce, domestic violence in the home, etc. And they sent the questionnaire out to thousands and thousands of people in the San Diego area who were all members of Kaiser Permanente. And sure enough, they got a ton of responses. When they started analyzing the data, they were shocked to find that almost 2/3 of the individuals who had submitted surveys reported having experienced at least one ACE, and most of them more than one ACE. They had absolutely no idea that childhood adversity was so prevalent, and bear in mind who we're talking about. Residents of San Diego who have Kaiser Permanente, they were 75% white, middle class. This is not the group that you would imagine having the highest levels of childhood trauma, so what must these rates actually look like in the general population? They retested more than once because they just couldn't believe that this was true. But the results came back the same. So what they did was they started comparing the number of ACEs that people reported on the survey to their health records from Kaiser. They were looking at physical health outcomes, things like diabetes, cancer, lung disease, depression, etc. And they were also looking at behavioral outcomes, things like alcoholism and drug abuse. And what they discovered is known as a dose-response relationship. And what that means is that as the number of ACEs increases, so does your risk for these negative physical and behavioral health outcomes. There are many categories that they assess, but I want to share 2 of them with you here. Let's take a look at this graph. For individuals who reported having experienced one adverse childhood experience, their risk for alcoholism increased by 100%, and their risk for attempting suicide increased by 80%. With 2 ACEs, that number increases to 300 and 200%, respectively. With 3 ACEs, that number increases to 390 and 560%, respectively. And with 4 ACEs, an individual's risk of developing alcoholism increased by 640%, and their risk of committing suicide increased by 1,220%. These findings are devastating, but perhaps the most staggering finding is that for individuals who've experienced 6 or more ACEs, on average, their lifespan is roughly 20 years shorter. In part 2 of this video, I'll be talking about how that is even conceivably possible. But in the meantime, feel free to check out the resources in my bio. I have linked to the article from Folletti and colleagues, as well as the ACE questionnaire and some of the graphs referenced here.